Today we will discuss asymptomatic HIV infection, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Asymptomatic HIV infection means that a person has HIV, the virus that causes AIDS, but does not show any symptoms. This can happen for many years, during which the virus is still active in the body, but the person feels perfectly healthy. How to know if you have it? Get tested. The most reliable way to know if you have HIV is to get tested. There are various types of HIV tests available, including blood test, which is done in a clinic or a lab, or an oral test using a swab in the mouth. Regular checkups. If you're at a higher risk, for example, if you have unprotected sex or share needles, regular testing is recommended. Know your status. If you test positive, a healthcare provider can help you understand and know your options as well as your next steps. Key points here to remember. Many people with HIV do not know they have it because they feel fine. This is what asymptomatic means you do not feel the symptoms. Early detection and treatment can help manage the virus and maintain health. If someone has HIV, here are simplified steps they should take. They should see a doctor, make an appointment with a healthcare provider who specializes in HIV, start treatment, follow the doctor's advice, and begin antiretroviral therapy, ART, which helps manage the virus. Regular checkups. Go for regular medical checkups to monitor health and address treatment if needed. Practice safe behaviors. Use condoms during sex and avoid sharing needles to prevent spreading the virus. Stay healthy. Eat well, exercise, and avoid smoking or excessive drinking to keep the immune system strong. Seek support. Talk to friends, family, or support groups to get emotional support and share experiences. In the hospital, if someone with HIV needs help, here is what typically happens. Testing. They may do tests to check the person's overall health and see how the HIV is affecting them. Medications. They will provide antiretroviral therapies, abbreviation is ART, to help control the virus and strengthen the immune system. They will treat infections. If the person has any infections or health issues, doctors will treat those as well. They will monitor health. Healthcare providers will keep a close eye on the person's vital signs and overall condition. They will offer supportive care. They may offer support for any symptoms like pain or nausea to make the person more comfortable if they happen to show a few symptoms. Education. Doctors will explain how to manage HIV and prevent further health problems after leaving the hospital. Here are some commonly used medications for managing HIV. Tenofovir, often combined with emtricitabine, brand names Vired and Truvada. Another medication is efavirenz, brand name Sustiva, and another one is raltegravir, brand name Isintras. There is also dolutegravir, brand name Tivicay. There is abacavir, often combined with lamivudine, brand name Zygen or Epzicom. There is lopinavir and ritonavir combination, brand name Caletra. So as you can see, the generic medications for HIV all end in IR. These medications can be used in various combinations to create effective treatment plans tailored to individual needs. Always consult a healthcare provider for the most appropriate treatment options. People at an increased risk of developing HIV include sexually active individuals, those who have unprotected sex or multiple sexual partners, men who have sex with men, this group has a higher rate of HIV transmission, injecting drug users, sharing needles or syringes can spread the virus, people with STIs, having other sexually transmitted infections can increase the risk, partners of HIV positive individuals, being in a relationship with someone who has HIV increases exposure risk, people with weakened immune systems, conditions that weaken the immune system can make it easier for HIV to take hold. Individuals in certain regions living in areas with high HIV rates can also increase the risk. Now you need to watch my video on alcohol withdrawal or have a look at benzodiazepine withdrawal.